Welcome to Mr. Senior Health, where we explore the secrets to a healthy and active life. Asterisk, have you ever found yourself taking furniture just to stand? Or holding your breath climbing stairs because your legs felt like they were on fire? Most doctors would simply call this aging. But new research from Harvard reveals a shocking truth. Weak legs are not inevitable. Asterisk, in fact, seniors with these four key vitamins regain leg strength more than twice as fast, some in as little as 72 hours. What's even more surprising is that even if you're taking these vitamins, 9 out of 10 seniors get them wrong. Without this one simple timing trick, you're missing out on half the benefits. This isn't just another health rumor. It's backed by clinical studies and decades of elder care. Stay with me, because by the end, I'll show you that timing trick. And we'll start with a vitamin your muscles can't contract without. Asterisk 1. Magnesium, the spark plug for your leg muscles. Asterisk, magnesium isn't as popular as vitamin D, but it's the spark plug your leg muscles rely on for every single movement. After 60, your body's magnesium levels drop significantly, yet it's crucial for asterisk muscle contraction, enabling smooth muscle function. Asterisk nerve communication, ensuring your brain and legs stay connected. Asterisk preventing nighttime cramps, reducing those painful jolts. Asterisk, have you ever felt sharp leg cramps in the middle of the night? Or a tired, sluggish feeling after walking just a few steps? Often, that's your body screaming, "I'm magnesium deficient." Magnesium truly helps your muscles contract and relax properly, supports nerve function so your brain and legs stay connected, regulates blood sugar and blood pressure, which affects muscle fatigue, and prevents painful spasms and cramps. Magnesium is involved in over 300 biochemical reactions, and without it, your muscles simply cannot perform. Asterisk signs of magnesium deficiency in seniors. Asterisk frequent leg cramps, especially at night. Asterisk muscle twitching or spasms. Asterisk heavy or stiff legs after walking. Asterisk difficulty maintaining balance. Asterisk constipation and fatigue. Asterisk according to a study in the journal Magnesium Research, over 50% of adults over 60 are magnesium deficient, and many don't even know it. In a study from the Journal of Physiology, seniors with magnesium deficiency showed reduced muscle strength and endurance. But after just 2 weeks of magnesium supplementation, their leg function significantly improved. Another study from the American Journal of Clinical Nutrition found that older adults consuming adequate magnesium could walk at a better pace, have fewer falls, and improve balance compared to those who were deficient. Asterisk, how much should you take? Asterisk recommended daily allowance for women, 320 to 400 milligrams per day. Asterisk men, 400 to 420 milligrams per day. Asterisk best form, magnesium glycinate or citrate, as they are highly absorbable and gentle on the stomach. Asterisk best time to take it, in the evening or after dinner, as it also promotes better sleep and reduces nighttime cramps. Asterisk foods that help: pumpkin seeds, almonds, spinach, black beans, and dark chocolate. But the reality is most seniors don't get enough from diet alone. Asterisk who should consider magnesium immediately: seniors with high blood pressure or type 2 diabetes, those taking diuretics or acid-blocking medications, if you frequently feel fatigued, cramped, or weak in your legs, or if you've had recent trouble sleeping. Magnesium can help with that too. So, before anything else, start with magnesium. It's the foundation, the switch that turns on your muscles so the other vitamins can do their job. Asterisk 2. Vitamin D3, reactivating your body's overall strength and balance. Asterisk next. The vitamin that restores your body's overall strength and balance. And most seniors have shockingly low levels. Vitamin D3. Most people know vitamin D3 helps with strong bones, but here's what they don't realize. Without enough D3, your muscles lose strength, your nerves slow down, and your balance can quietly disappear. Vitamin D3 isn't just a vitamin. It acts like a master switch, controlling your muscle system, nerve health, and bone strength all at once. Asterisk why do seniors struggle with D3 deficiency? After age 60, your body's ability to produce vitamin D3 from sunlight dramatically decreases. Your skin becomes thinner, your kidneys and liver convert D3 less efficiently, and you might spend less time in direct sunlight. As a result, you move slower, your legs feel heavy, your balance becomes shaky even if you eat a normal diet. Asterisk a clinical trial at the University of Birmingham found that seniors who simply took 800 IU of D3 for 5 days had a 19% increase in leg strength. A study from Harvard's Gerontology Research Center showed seniors with low D3 were 40% more likely to fall or be hospitalized, and in the Chinese study, even seniors with almost no exercise regained leg strength simply by correcting their vitamin D3 levels. Symptoms of vitamin D3 deficiency, difficulty climbing stairs, leg cramps, especially at night. Fatigue from simple tasks like walking, feeling off balance or fear of falling, pain in hips, knees, or heels, restless sleep or mild anxiety. These aren't random aging signs, they're red flags for D3 deficiency. How to take it. Recommended dosage, generally 800 to 1000 U per day. Seniors with a history of weakness or falls, 1500 to 2000 U per day. Best form, vitamin D3 cholecalciferol, not D2. Best time to take it, morning or early afternoon, always with a meal, containing healthy fats like salmon, eggs, or avocado for proper absorption. Avoid taking D3 at night. It can interfere with sleep. Can you get enough from food alone? Not really. Here's why. 3 ounces of salmon is about 500 U. 1 egg is about 40. 1 glass of fortified milk is about 100 U. You need to eat multiple servings of fish and eggs every single day just to meet the minimum. And most seniors simply don't. Who should take D3 seriously. If you've ever fallen or felt unstable, spend most of your day indoors, have joint pain or osteoporosis, follow a plant-based or low-fat diet, have dark skin, or wear long sleeves outdoors, which blocks UV rays. D3 safety tip, don't overdo it. Over 4,000 U per day long-term can cause high calcium levels, kidney stones, nausea, or irregular heartbeats in sensitive individuals. Always get your blood levels checked every 6 to 12 months, especially if you take supplements long-term. In summary, vitamin D3 reactivates the muscle system, leading to stronger steps, better balance, and faster reaction times. 3. Vitamin B12. Connecting your brain to your muscles. Now you've got the energy spark from magnesium and the whole system reactivation from D3, but something is still missing. What connects your brain to your legs and controls your every step? That's where vitamin B12 comes in. Vitamin B12 is often called the memory vitamin, but for seniors, it's so much more. B12 is the critical bridge between your brain and your body. Without it, your legs can feel like they aren't listening to you. You might feel off balance, unsteady, or even a little numb, and it all starts silently. What happens when B12 is low? You feel tingling or burning in your legs. Legs feel weak or heavy, especially when standing. You lose your balance even on flat ground. Reaction times slow down, and walking feels like you're dragging weights. Your feet can even fall asleep. For no reason, many seniors mistake these signs for just getting old. But the real cause is often B12 deficiency, and it's more common than you think. Why are seniors at risk? There are 2 main reasons B12 deficiency skyrockets after age 60. Reduced stomach acid. Needed to extract B12 from food. Medications like metformin, omeprazole, and antacids block B12 absorption. Even if you eat well, your body may no longer absorb enough B12 from meat, fish, or dairy, especially if you're on certain medications or primarily eat a plant-based diet. What B12 really does. Builds the protective myelin sheath around nerves. Boosts signal speed and coordination between the brain and muscles. Supports red blood cell formation for oxygen delivery to muscles. Increases power energy metabolism so your legs don't tire quickly. Real research results. In a clinical trial published in the Journal of Gerontology, seniors over 65 were given 1,000 micrograms of B12 per day for 8 weeks. The results? Less numbness, better coordination, stronger lower body power, sharper focus, and fewer balance issues. Another Oxford study found that B12 deficient seniors were twice as likely to fall and walked significantly slower than those with healthy levels. Signs: you might be low. Feeling wobbly or lightheaded. Feet feeling disconnected from your body. Mood swings. Brain fog or fatigue. Trouble walking in a straight line or stepping quickly. Forgetfulness or poor sleep quality. How to take it. Asterisk recommended dosage, 500 to 1000 micrograms, 0.5 to 1 milligram per day. Asterisk best form, methylcobalamin. It's already in active form and doesn't need to be converted. Asterisk best time, morning or midday. Avoid coffee and tea within 1 hour as they block absorption. Look for sublingual tablets under the tongue, sprays, or chewables. Asterisk, can you get enough from food? Unlikely. Here's the math. 3 ounces beef liver is about 70 micrograms. 3 ounces salmon is about 4.5 micrograms. 1 large egg is 0.5 milligrams. 1 cup of milk is 1 milligram. It would be nearly impossible for most seniors to meet daily B12 needs without supplementation, especially with reduced absorption after 60. Asterisk, who should take B12? If you feel leg numbness, tingling, or trip frequently, if you use acid blockers, antacids, or metformin, if you're vegetarian or eat little animal products, if you've had stomach surgery or digestive issues, if you feel tired all day, even after rest. Asterisk, is it safe? Yes, B12 is water soluble, and any excess is flushed out through urine. There's no known toxicity, even at high doses. But if you have kidney disease or are on blood thinners, always consult your doctor. Asterisk for vitamin B1 thiamine, the forgotten fuel for tired, heavy legs. Asterisk, so now we have one that sparks your muscles with magnesium. To that reactivates your power system with vitamin D3 and reconnects your brain and legs with vitamin B12. But there's one more piece of the puzzle. What gives your legs enough energy to move? That's where the final vitamin, vitamin B1 thiamine, comes in. Asterisk, magnesium, D3, and B12 all play critical roles. But without vitamin B1, your muscles have no fuel. Thiamine converts the food you eat into ATP, the energy your muscles need to contract, move, and recover. It's like trying to start a car without gas. Your nerves might be firing, but your legs won't go far. Asterisk, signs of vitamin B1 deficiency. Asterisk, your legs feel tired right after walking a short distance. Asterisk, you experience cramps, especially in calves or feet. Asterisk, a dragging or heavy sensation in your legs. Asterisk, you feel weighed down after standing. Asterisk, you've lost your appetite and desire to move. Asterisk, occasional confusion or mental fatigue. Asterisk, if this sounds familiar, it might be more than just aging. It could be low thiamine. Asterisk, why is it common after 60? There are several reasons why seniors often fall short on B1. Asterisk, poor absorption. Digestive changes reduce how well thiamine is absorbed. Asterisk, medications, diuretics, antibiotics, and metformin all deplete B1. Asterisk, alcohol, even light drinking interferes with thiamine absorption. Asterisk, low intake. Many processed foods strip out B1, and seniors often eat fewer whole grains and legumes. Asterisk, even a slight deficiency can cause big problems with energy and mobility. In a study by the University of Tokyo, over 30% of older adults tested had low thiamine levels, and those also had slower walking speeds, less power climbing stairs, and a higher risk of leg fatigue. Another study in the Journal of Neuroscience gave patients 100 milligrams of thiamine per day. After just 7 days, 82% reported higher leg endurance. 68% reported less heaviness and pain. Asterisk, what B1 really does. Asterisk, fuels the Krebs cycle, which creates ATP energy. Asterisk, helps nerve cells communicate, especially in the legs and feet. Asterisk, speeds up muscle recovery after exertion. Asterisk, reduces feelings of fatigue and physical exhaustion. Asterisk, how to take it. Asterisk, recommended daily allowance. Men, 1.2 milligrams per day. Women, 1.1 milligrams per day. But for seniors with symptoms, doctors often recommend 50 to 100 milligrams per day. Asterisk, best time, morning with food, ideally with some protein. Avoid taking with coffee or black tea as they can block absorption. Asterisk, best form, metformin or thiamine hydrochloride. Both are effective and well absorbed. Asterisk, food sources, brown rice, lentils and beans, sunflower seeds and liver, fortified cereals. Again, seniors often don't eat enough of these foods daily, and many medications push B1 out of the body. Asterisk, who should consider thiamine? Anyone feeling heavy legs or deep fatigue after mild exertion. Seniors taking blood pressure medication, diuretics, or metformin. Those with poor appetite or unintentional weight loss. Anyone feeling mentally exhausted or physically sluggish. Asterisk, is it safe? Yes. Thiamine is water soluble, so excess is flushed out. It's considered one of the safest energy-supporting vitamins for older adults. But if you have liver or kidney disease, consult your doctor before using high doses. Asterisk how to combine these for vitamins for maximum effect. Asterisk so now you know all for vitamins that help seniors quickly rebuild leg strength. Magnesium stimulates muscle movement. Asterisk vitamin D3 reactivates strength and balance. Asterisk vitamin B12 restores nerve-muscle connection. Asterisk vitamin B1 thiamine boosts muscle energy and endurance. Asterisk now how to combine them for maximum effect. Even the most powerful vitamins can work poorly if taken at the wrong time or on an empty stomach. Let's break down the optimal timing, food pairings, and sequencing so you can get faster, more reliable results. Asterisk timing strategy, when to take each. Asterisk magnesium, evening, after dinner with water, helps with sleep and it reduces nighttime leg cramps. Asterisk vitamin D3, morning, right after breakfast with healthy fats like eggs, avocado, or salmon. Asterisk vitamin B12, midday with or right after lunch. Do not combine with tea or coffee. Asterisk vitamin B1 thiamine, morning with your first meal. Ideally breakfast with protein or whole grains. Asterisk sample daily routine. Asterisk breakfast, a boiled egg or Greek yogurt, half an avocado or whole grain toast. Vitamin D3 plus B1 taken together. Asterisk lunch, baked chicken or salmon, steamed vegetables or a light salad. Vitamin B12. Asterisk evening, magnesium after dinner. Asterisk the most common regret I hear from seniors is, I thought it was just aging. I wish I had done something sooner. Now you know better. Start with 1 or 2 vitamins today. Add the rest as you feel ready, and always consult your doctor if you're unsure. Your body has the capacity to recover, but you have to take the first step. It's your turn. Asterisk I want to hear from you. Have you ever tried any of these vitamins before? What changes have you noticed in your legs, energy, or balance? Leave a comment below. Your story could help others. Asterisk also, if you found this video helpful, hit the like button. Press subscribe for more senior health tips on Mr. Senior Health. And don't forget to share this with a loved one who's struggling with leg strength or mobility. Thank you for watching, and remember, your legs carry more than just your body. They carry your independence, so take care of them, one strong step at a time. Asterisk subscribe to Mr. Senior Health to stay updated on the latest and most helpful senior health information.